Hi, Ms. Thompson. My name's Katie. I'm a nursing student, and I'm going to be helping to care for you today. This is my instructor, Ms. Scott.
Ms. Thompson, hi.
So I'd like to give you your eye drops and also some medication for your ear infection.
Thank you.
Sure, and I'm just going to warm up those ear drops with a little warm water. Here we are. First, I'm just going to lower your arm rest.
Okay.
Raise your bed a bit. You comfortable?
Yes,
Good. Get my gloves on here. Now I just need to inspect your ID bracelet. Okay, can you tell me your name?
Barb Thompson.
Great. Next, I'm just going to clean your eyelids with a bit of saline solution. It looks like you have a little drainage.
Okay, there you are. You should move from the inside of the eye to the outside. And remember to use each area of the gauze only once.
Okay.
Very good. And only once. There.
Great.
Okay.
Looks good. Okay, the other eye.
Yes.
Now I'm just going to need you to tilt your head back slightly. There you go, great. And is it okay if I touch your head?
Yes.
Okay. And I'm just going to have you look up and focus on a spot on the ceiling. Okay, great.
Okay. To apply the drops, place the thumb or the two fingers near the margin of the lower lid, just below the eyelash, exerting pressure downward on the bony prominence of the patient's cheek. Now, this will expose the lower conjunctival sac. You see it?
Yes.
Good, good.
Okay, now, Ms. Thompson, I'm just going to ask you to keep focusing on that spot on the ceiling so you keep from blinking.
Now, move the dropper closer to the eye, but be careful not to let it touch the patient's eyelid or the surface of the eye. Okay, now squeeze the container, allowing the number of prescribed drops to fall into the conjunctival sac, but do not let the drops fall into the cornea.
Okay.
Good. All right?
1. Good job. Yeah, keep focusing on that spot. 2.
Miss Thompson, you can wipe that off with a tissue later, okay?
There you go.
Okay.
Got your tissue there? So what I'm doing now is just applying a little bit of pressure to what's called the inner canthus.
Good.
And that'll keep any of the drops from flowing into your tear duct. Great. You can keep your eyes closed if you like and just wipe some of that extra off. All right. Now the other eye. Just do that real quick. Great.
Good.
Now remember, Ms. Thompson, not to rub your eyes, okay? And next we're going to administer the ear medication. So I'm just going to help you to roll over onto your side so we can expose your infected ear. So if you just roll this way a little bit. Good. And I'm just going to lower the head of your bed for a moment. Great. Okay. So I'm going to clean off some of the drainage around your ear with a little bit of saline moistened gauze. Okay. Great.
Good job, Katie. Good.
Great, thanks. Okay, so I've got the eardrops here.
Now, is it warm enough?
Yeah, they do feel warm.
Great.
Great. Now, Ms. Thompson, you may feel a little pressure on your ear as I pull up and back just to straighten out your ear canal.
Now, hold the dropper in the ear with the tip just above the auditory canal, but be sure not to touch the skin.
Got it.
Just like the eye drops. Squeeze the bottle to give the prescribed dose and let the drops fall on the side of Miss Thompson's canal.
Okay.
Okay. Now, once you're done, you can release her ear.
Okay.
Good.
Now, Ms. Thompson, I'm just applying pressure to your tragus to help the eardrops move from your ear canal to your tympanic membrane. Okay.
And don't forget that Miss Thompson's doctor has instructed that a cotton ball be inserted loosely in the ear canal, and that's to prevent the medication from leaking out.
Okay.
And remember, if both ears require drops, you should wait at least 5 minutes before administering it into the other canal.
All right, I'm all done, Ms. Thompson. I'm just going to raise the bed back up to a more comfortable position for you.
Good.
And put this bar back up for you.
Yes. Okay.
Take care. Okay.
Okay.
Oh, let me mark this down
Yes.
before we go.